Hi everyone, my name is Bruce Farr. I'm the retired chief of Toronto Emergency Medical Services, and I'm currently the past president of the Paramedic Chiefs of Canada. I'd like to provide you with a brief history of the Paramedic Chiefs of Canada. During the 1980s and into the 90s, there were a number of ambulance services across Canada that were rapidly expanding their services to keep up with the demand for improved emergency pre-hospital care in their communities. Development of advanced care paramedic programs introducing specific delegated medical procedures for paramedics in the field was the main focus as our profession was looking at a major shift in the type of service that we delivered. In 1995, a number of EMS services from across the country started talking together, discussing common issues, sharing ideas about best practices, and pooling resources. Most importantly, they discussed the need to formalize their efforts and develop an organization to lead, promote, and further develop emergency medical services in Canada. As a result of many formal meetings and annual conferences across Canada from 1995 to 2001, the leaders of 12 services met in Ottawa in 2002 for about 3 days to develop the bylaws and policies and the business strategy to launch the Emergency Medical Services Chiefs of Canada. These leaders had organized themselves into the board of directors who would lead the further development of EMS across Canada. The organization was also officially federally incorporated in 2002. The board of directors became the official national voice for EMS in the areas of best practice, benchmarking, standards, leadership, advocacy, and education. Over the next few years, this new board put significant effort into the development of a white paper outlining 6 key strategies and 11 priorities for EMS in Canada. This white paper was formally introduced across the country by national and local media releases involving all of the participating services. The title of the document was "The Future of EMS in Canada, Defining the New Road Ahead." This document became the official guide to developing EMS systems across Canada and raised awareness internationally as well. Your board also began the important process of developing strategic partnerships with our key stakeholders, both here and abroad. Similar key developments in our profession were also underway in the UK, Australia, and the United States. Relationships with these services and organizations were critical in our efforts to keep Canadian EMS strong and well respected among the leaders in the world. And a historian by the name of Leonard J. Sweet said, "The future is not something we enter, it is something that we create." The EMS Chiefs of Canada had charted a course for a comprehensive and effective system of community-based pre-hospital care right across Canada. Over the years, your board has promoted our 6 key priorities as a means to improve our profession. These priorities include clear core identity, stable funding, systematic improvement, personal development, leadership support, and mobilized healthcare. Significant efforts have gone on into this direction, and with that, we have seen the evolution of community paramedicine, improved interoperability among the 3 emergency services, and increased government relations. We've also seen major improvements in safety and support for all workers in the emergency services. Last year, as part of our annual fall business meeting, your board conducted 45 meetings in 1 day with senior government officials on Parliament Hill in Ottawa. The following 3 key messages were discussed. The federal government should study the community paramedic model as a way of reducing the burden on the overwhelmed primary health care system in Canada. The federal government should make automated external defibrillators mandatory in all public buildings. And finally, the federal government should designate the remaining 10 megahertz of spectrum for public safety use. Now, immediately following these meetings, our president was invited to be present at the Federal Committee on Health Programs. With the recent name change to Paramedic Chiefs of Canada, your board has started to work on a new strategic direction. We need to determine our new priorities and how we should proceed from here. Areas of focus will include membership services, finance, our organizational structure. Additionally, we will develop strategies on how to deliver services, influence policy, coordinate our action, develop partnerships, and continue to guide the industry. These continue to be very exciting times for our paramedic profession here in Canada, full of opportunity for staff at all levels. Your board will continue to work hard to ensure that we are serving our members, our patients, and our communities to the fullest extent possible.